Welcome back, Dr. Ibe, once again, your platform medical advisor. I think we need to pause for now our weekly medical and general advice and talk about what has been happening recently on this about this COVID-19 coronavirus. And that's with regards to the vaccines, the presumed treatment, and lockdowns and restrictions. Let me say it again, there is no conspiracy out there. There is no agenda to eliminate or to use these vaccines on any ethnic group, any race. There is no conspiracy to use that on any group as to eliminate them or on trial basis at all. No clinic, no hospital, no doctor has received these vaccines to use on groups. Please trust me on that. I'm in the front line. I work every day. I see patients every day. We have not received these vaccines on people. And when we talk about the vulnerable group, yes, of course, blacks and the ethnic minorities are the ones dying the most with this COVID-19. However, I had mentioned as well that we have those with underlying serious health conditions, cancers, diabetes, asthma, COPDs, and so forth and so on. These are groups of the vulnerable groups. They don't have just a race in mind when they talk about that. Secondly, yes, we are excited about this dexamethasone, and it has been proven to be effective after a trial. It was used on patients who were very unwell on the end stage of this COVID-19, which is those that were on oxygen and ventilators. But we have not been advised to use them yet. It is not a medication for prophylaxis. It is not meant to be used for any sign or symptoms of mild COVID, cough, dry cough, loss of sense of smell, and so forth and so on. We've not been advised to use that. So you don't use that thinking that can prevent the COVID from happening to you. Dexamethasone, just like every other steroids, they are good in some cases, allergic reactions, asthma attacks, and so forth and so on, arthritis, and so forth and so on. But they've equally got loads and loads of side effects. They can cause diabetes if used on long-term basis. They can mess up your metabolism. They can mess up your immune systems. They can mess up your bone density. So it's got lots of side effects. Please don't use them. Don't think that you can use them if you start coughing or if you've been advised that you have mild COVID after a test. Please don't do that. Thirdly, I equally mentioned that, yes, lockdowns have been relaxed a little bit, restrictions lifted, but this this coronavirus is still out there. We still have to keep on obeying the instructions, maintaining social distancing, wearing a mask at all times, being mindful of what and who you touch out there. We cannot take this for granted. I mentioned this today. Please let us in no way lower our guards because the virus is still out there. It's still highly contagious. Okay, so I felt that I summarized these three things because I keep on getting queries, calls, text messages, WhatsApps, and so forth and so on. Okay, there is no conspiracy to eliminate any group, any race, place. The dexamethasone, yes, has been proven to be effective on COVID-19 after a trial. Yes, lockdowns have been relaxed, restrictions some lifted. Please, let's still be careful anyway because this COVID is out there. And I had mentioned earlier on, let's be mindful of fake news. Be mindful of what you watch, what you hear, what you read, what you see. Be mindful of that. And if you have any concerns, any queries, just like most of you have been doing, and thank you all for that, please text me, call me, send me messages. If I don't know the answers, I would research and get back to you. Let's be mindful of fake news, please. This virus is still out there, but we are winning the war. We have won the war indeed. Just a little bit left. Okay, so I felt I let us know today. Once again, please take care of yourselves, your family members, your loved ones. Maintain your social distancing. Wash your hands with soap and water for 20 seconds or with a sanitizer. Be safe and keep safe. Play safe at all times. God bless. Bye.